Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I want to tell a story about this patient, Grant, who we recently took braces off of. And the point of the story is really not what we did with his teeth, but I want to introduce you to his mouth anyway so that you have an idea of what happened during his treatment. So this is Grant when he started treatment. Here's a close-up of his teeth. We started with a gap between the two front teeth. Otherwise, we started with some very, very crowded teeth, both on the top and on the bottom. And to appreciate just how crowded things are, here's a shot of his lower teeth. You can see over on the left side here that there was a whole adult tooth that belonged between this adult tooth and this one. We're also crowded over on the right side as well. Here's his upper teeth when we started. The right side is crowded. The left side is even more crowded because once again, there's a whole adult tooth up underneath of the gums that belongs between this one and this one. So sometimes when teeth are really crowded, we opt to take out teeth. And so in this case, we took out this tooth and we took out this tooth to make space for the two that are still up underneath of the gums. And you'll see our progress here. This is kind of midway through treatment, looking at his upper teeth. On the right side, the one adult tooth has already come in and you can see that we've already closed up all of the space. On the left side, we have a lot of space opened up so that this tooth can come in. We really needed to open up plenty of space because this tooth was kind of stuck up under the gums and really needed a lot of space to be able to come into the mouth. If we look at his lower teeth midway through treatment, you can see here's where we extracted the one tooth, here's where we extracted the other tooth. We had to utilize that space to unravel all of the crowding of the front teeth. And here's Grant's lower teeth at the finish. You can't tell hardly that he's missing two teeth. Everything is really nice and straight. Here's his upper teeth at the finish of treatment. Once again, you can barely tell that he's missing two teeth. Everything looks really beautiful. This is a little bonded retainer that goes on the back side of his two front teeth to just make sure that his gap never comes back. Here's a look at the end of his teeth, end of his treatment, the front. And once again, just a reminder of where he started. And back to here. But the story about Grant is not about how we got to this. The story about Grant is how we started with this kid. Grant was so nervous when he first came into our office that he was shaking. He was shaking so bad that the chair was moving and we were unsure about what work, if any, we could get done on Grant. And we decided, like we do with every patient, that the best thing to do was to meet Grant exactly where he was. We wanted to meet him in his fear and meet him in his anxiety. We had to take things slow, so it was okay if we didn't get done everything that we wanted to get done. We had to explain everything to Grant. Grant, this is what we're doing. We had to show him, and then we could do it. And slowly but surely, we gained Grant's trust. And about midway through treatment, he told his mom that he did not want his mom coming into the office with him anymore. He was going to do it by himself. And so we saw just tremendous growth as we were going through treatment. And when we got to the end of treatment, Grant was pretty much like any other teenage boy. He still was a little bit anxious, but he endured treatment just like anybody else, and he really grew up. This is Grant at the end, and Grant's still learning how to smile and show off that new smile that he has. But what I'm really proud of about Grant is how much he grew through treatment, how he overcame his anxieties. And I'm proud of us, and I'm proud of my team. I'm proud of how we met him exactly where he was. I'm proud of how we took things at Grant's pace, and I'm proud of how we built his trust in us. Here's Grant at the end. And I know that this guy is going to go do amazing things. I'm so proud of how he made it through treatment. I'm so proud of how he overcame his fears. And Grant, we're going to miss you, buddy. You were an awesome patient. And we just thank you for your trust in us. And to all of the JFO patients and families out there, thank you for your trust in us. This is what we do all the time. We can take even the most anxious patients and we can still get great work done. So thank you. I hope you enjoyed that story.